Hi everyone, myself Dr. Sumantro, a pediatric nephrologist, and along with me my colleague Dr. Poonam, pediatric surgeon with keen interest in pediatric urology. So we both belongs to Neotia Bhagirathi Women and Child Care Center, an exclusive pediatric multi-specialty hospital in the eastern region. So today we are going to discuss about a very interesting topic about urine leak. Many times parents are fearful to discuss about this leak in front of public forum. So, not an uncommon phenomenon in our today's OPD practices. So, Dr. Poonam, can we just know a basic idea how common is this urine leak is, and how commonly you face this in your own OPD, in your own pediatrics surgery as well as pediatric urology OPD?
Yes, urine leak in children is fairly common, and after this COVID period, because the children are glued to the TV and all, so these things probably have increased further. So in my routine OPD practice, around out of 2 out of every 5 or 6 children come with some or the other urinary problems. That common. So urine leak, when children come, they come with either daytime problems or bedwetting. Bedwetting is a very common problem in children. Basically, small children. I would like to ask you, in young children, we say bedwetting would be there. So till
Right.
what age is it normal, or what is your take on bedwetting in children?
A tricky question actually. So basically, bedwetting is not that uncommon. Truly speaking, every 8 or 10 child entering in my OPD might be a bedwetting. It's around 15% at the age of 5 years. But luckily, it has a spontaneous resolution, and by 15 years, only 5% child will have this problem. So many a time, after 7 years or 8 years of age in India or in any country, may be at times parents try to ignore this thing because many a time there is a social taboo regarding this bedwetting. Many a time they think that it will be spontaneously overcome in due course. But we need to ascertain that why this bedwetting is actually, what is the deep rooted cause, and does this child need management or not, just an observation that we need to know.
Yeah. So in many families, there are kids who are bedwetting till later age.
Right.
Many parents take this as normal. So which parents should seek treatment for their children? What is your suggestion on that?
Correct. So directly jumping to treatment, before that I will like to have some primary inquiry about what are the other symptoms. Is it only a bedwetting or something else is add on to that? Many a times parents just ignore because many of the parents might have a prolonged bedwetting till 10 years or 12 years. They might be ignoring the child who is already 7 years or 8 years of age. But as a protocol, we usually after 5 years to 7 years of child, if a child is still wetting his or her bed, we need to inquire, is there any other daytime symptoms? Is he leaking in the daytime also? Is there is other urinary problem, any poor stream for a boy child, or any difficulty in passing urine for a girl child? If that's so, we try to document this type of urine streams in our multiple videos capture or by some other things. Then we need some basic investigations. We don't need many high-fi investigations like a CT or an MRI like this. A simple urine test, a simple ultrasound of kidney to know any structural abnormality is there or not, or might be a simple blood test for kidney function, urea and creatinine is enough. Before that, we need to inquire very well that how the child is passing his or her urine in the daytime and also in the night time. So there is called a voiding diary, simply like this. We try to document how many times the child is passing in the daytime. Many a time we try to document how is the volume of the child's as per their age group, how much volume of urine is passing in every time, how is his potty habit parallelly. And then after this documentation, we need to know is the child is passing more amount of urine at night, so that's why he is urinating at bed, or the child is not passing more amount, but the bladder capacity becomes low at the night time. So many a times among these two, the treatment in due course might be different. So saying so, after this type of voiding diary, when you find this, after that we might ask the parents and the child if at all they are bothered with this bedwetting, because bedwetting treatment is only being done if there is some problem with the parents and with the child. Otherwise my treatment is going to fail, because that needs an intense compliance with my therapy. The therapy does not include only medicines. The therapy actually includes first behavior therapy, just simply like keeping huge amount of water per day, but only at the daytime. After 8 p.m. or 9 p.m. we try to restrict the water intake, and before going to bed we ask the mom to at least pass at least few drops of urine before going to bed. And many a times a strict no to our cola drinks or any tea or coffee for this child, and a good bowel habit. That means if any doubt about constipation, we need to treat the constipation well with this intense behavior therapy. And if the child wrongly passes in the bed, so no punishment. Punishment can be counterproductive. If you punish the child, bedwetting might be more. So, but if the child remains dry, can be a prize system. We can give some small toffees, fries, etc. So we can encourage the child by positive reinforcement. And with this behavior therapy for 3 to 6 months, if the child have this behavior therapy with good compliance but still failing, then we might jump to any of the therapy, either a bed alarm or maybe some medications like desmopressin. We can try any of this for at least 3 to 6 months. But remember, this type of therapy has a huge chance of failure if the child is not following all your behavior advice. So if the child fails despite a proper therapy, we might exchange the therapy after 6 months or maybe a combination of therapy. Most of the child, if they are following the advice of your doctors and the parents are also following the proper guidelines, success rate is quietly fair, around 60 to 70%. And many a time the child can get spontaneous correction also over a time. So not that a bad disease, but problem is with the social taboo. Parents don't speak us about the bedwetting. The incidents what we are seeing is just a tip of iceberg. Many of the child, they have a social taboo with this. They might feel same in discussing within their school WhatsApp groups or something else. So if the parents are coming to us, we must congratulate the parents first that you are courageous enough to discuss these things within us. But many a time this bedwetting is not only a night wetting. There can be some associated symptoms also, particularly different type of urine leak can be there. There can be a daytime wetting, there can be other type of leaks. So this many a times does not comes to a pediatric nephrologist alone. They might go to any other center like gynecologists, like their physicians, like their pediatrician, but mainly their pediatric urologist or pediatric surgeon also. So when this type of child drops your OPD, so Dr. Poonam, what is your next step then? How to differentiate this big basket of choices of different type of wetting, different type of urine leak?
Yes. So for that, we need to know first of all what different other causes may be there for wetting or leakage in children. So there may be problem with the bladder, there may be problem with the ureters.
Yeah.
There may be many reasons.
Okay.
So of that, the most common things that we find now is the problem of constipation. So
Why so?
constipation, yeah, because constipation is a very common problem. Children do not want to go to the toilet. They do not go to toilet on time. So what happens is in the body, there's the bladder and there is the urethra, which is allowing the urine to come out. Just behind that is the rectum, which is the last part of the intestine, which is storing the poop, and the poop comes out from that. So if there is constipation, the rectum swells up. Once the rectum swells up, it irritates the bladder and it causes urine leakage. So the most commonest and most innocuous cause of urine leakage or any sorts of urine problem in children is a loaded rectum, that is constipation. So most of these cases, if you
how
manage
can parents
constipation,
know that the child is constipated? Many times the parents doesn't tell us about constipation. They just tell us about the leak. How to know that?
yes, it's usually the parents do not tell us about the constipation at all. We have to extract the history from them, that whether the child is passing stools daily or not, whether they're passing stools daily with a proper routine or not. Most of the kids are going to the washroom whenever they feel the need to pass stools. If they are not feeling the urge, they are not made to sit at the proper time. So they do not develop that reflex that child wakes up and goes to pass stools. That is not developing at all with the current scenario. So these children usually have some or the other urinary problems. So this is one thing. There is lots of other problems also. There may be some congenital, that is by birth, problem of the kidneys or the ureter or the bladder, because of which there is some amount of urine leakage. For example, if the ureter is supposed to carry the urine from the kidney to the bladder, if that is opening at a separate place, it is not opening into the bladder, that can cause
just
urine
like
leakage.
ectopic ureter like this.
Yes, that is called the ectopic ureter, that can cause urinary leakage.
Mostly in case of girls or boys, this ectopic
yes,
ureter?
it is usually seen in case of girls. Girls with ectopic ureter will have urinary leakage. But
and
that
for
leakage,
boys, something we are more cautious about, some other diseases.
There
like
are other
for
diseases. Yes, there are other diseases, like there is some obstruction in the urethra. That is the tube which carries the urine from the bladder to the exterior. That is called the urethra. If there is a blockage in that, that will cause pressure on the bladders and that can cause urinary leakage. This is called posterior urethral valve in male. That is the most common problem in males, which can cause urinary leakage. Rather than being the most common, what we are scared about is this disease, if left untreated, can cause kidney damage in the long run. So we have to diagnose this problem at the earliest. So there are other problems also. For example, there is
how to diagnose this? Any simple test, just like my bedwetting, there are some simple tests. You also are suffice for the simple test or something extra?
No, usually we first go ahead with a simple test, then we go ahead for the elaborate test.
Can we know
first simple test that you already told is the voiding diary. That is important for any child with urinary leakage. That has to be very nicely preserved. And after that, next comes the ultrasound. Again, that's a very simple test. Ultrasound has to be done by a very proficient person who is able to do pediatric ultrasound, because my patient can be suppose 3 months old, 6 months old, or at the same time he may be 16 years old also. The person should be absolutely able to do USG in different age groups. He should be able to understand disease process in the different age groups. So that is usually not possible for the person who is trained in adults.
Right.
So in our
So a
center,
masterpiece of ultrasound for adults might not be a good master for pediatric
Yes,
also.
absolutely.
He might not be knowing what is a normal or abnormal thing for pediatric.
for a
different age
pediatric.
group.
So we have in our center, we have got good trained
Pediatric
radiologists,
neurologist, okay.
neurologists who are dealing with kids only. They are not they're dealing
That's
with. They do not have to deal with adults.
Any
So
other
USG
test, Dr. Poonam?
Yes. So once
If
the USG
something
is
is-
done,
Yeah.
if we need more, it's not that all the children are needing more tests, but there
Okay.
are other tests also which may be needed. For example, the MCU, the urodynamics. These are all invasive tests. That is, they may need the insertion of catheter into the bladder. So these tests are very specialized tests. These are available at many places, but for kids, these are available at very few places. In our hospital, we do not allow the technicians to do the test at all. We do the test ourselves. We put the catheter ourselves and do the test ourselves. So,
So
that
putting
also,
a catheter in the urethra, many of the time parents might be fearful of this thing. So how can you make it easy?
for our center, what is important is only we doctors perform the test ourselves.
Okay.
That is the first most important.
Very rare centers in Eastern Zone is doing that. Mostly
Yes,
are done by
most by
technologists or
technicians. By
technician, okay.
technicians. So our center, we do the test ourselves. We do not allow the technicians to do it at all.
Okay.
So the chances of complications or infections are there after each and every test. But if the doctor is doing it, the chance of complications are very less.
Okay.
Right? We
Fine.
can handle the kids. We are doing the test only on kids. We are not doing it on adults at
So
all.
what extra information about that MCU can provide us
Yes,
for
it
a
can-
boy, a child, or maybe a girl
Yes, it can
child?
provide us a lot of information, like whether there is any reflux or not, whether there is any blockage or not,
Okay.
because these problems may require surgical management.
Right. And what type of surgery or how it is difficult to do? You have trained in from PGI Chandigarh, a Premier Institute of India. So you might be dealing with maybe of 2 kilo child or 1 kilo child or even lesser. So is there is a technical difficulty between treating a bigger child versus this type of small kids?
Absolutely, it's a whole different ball game. The anesthesia, the surgical team, everything they have to be all equipped and they have to be trained to deal with kids. Small kids are challenge. Their IV access is challenge. Everything is challenging. But we have got a wonderful team here. Our anesthesiologist is great. The OT, all technician, all staffs are good. The pediatric wards are wonderful. We have got all sorts of small instruments with which you can work in kids. So for us, working with kids is a easy task. But if we talk of adults, if somebody else or adult surgeon is dealing with these kids, it may be a daunting task for them. But
Right.
for us, we are dealing with kids only. We do not work with adults at all. So the things are much easier for us.
So as just like bedwetting mostly require medical management, this type of time waiting or other type of urine leak mostly might be some surgical intervention needing also.
They may need surgical
Right.
management. Many
So
of the kids
many times
need.
the child for the kidney care comes to a nephrologist. Then again for a separate appointment for a separate day they go to a pediatric surgeons and a pediatric urologist. So how difficult is the task for the parents itself to go from door to door to knock for a separate appointment?
Absolutely. This is
So
the
how
best.
can it be made easy?
Yes,
Is there
this is
any way for
the best thing is to have a joint nephro-uro care so that the patients can come in,
And how's
they
that?
can have opinion of both the people, and that's possible because we have made it possible at Neotia at least, because we sit
So great.
under one roof in one room so that the parents come in, they can have both of us opinion.
Right.
Because when two minds working behind one case,
Right.
definitely gives better results.
Right.
And probably this is our only center in Eastern
Oh,
India,
Eastern.
or yes,
In a pediatric multi-specialty hospital where only this nephro-uro joint clinic has been happening
Absolutely.
successfully for the last 3-4 years.
absolutely.
So,
with a
in a
specialist,
same
with a
table-
specialist who comes from
Yeah.
AIMS and a specialist who comes from PGI.
So same table, a pediatric nephrologist and a pediatric surgeon with keen interest in pediatric urology is dealing the case. So parents doesn't need to move from door to door or a
Absolutely.
appointment. So their time is saved. Obviously their money is also saved.
Absolutely.
And so in nutshell, this type of urine leak children requires some intense monitoring. Many a time they might not be needing a surgery or like this, but a simple investigation which
There may be parents who may think that okay, the child is leaking now. We wait for some time, let the kid go older, and then we will treat. So, is there any
Are we
harm in
miss-
waiting?
Yeah, so are we missing the bus? You're asking like this.
Absolutely.
Yes, there may be a chance that we are missing the bus. Whenever after 10 years or 12 years the kid comes to us, already the renal failure has already happened. So to protect your kidney, to protect your kidney functions, even for your post-surgical case also, after the end of surgery, it's not the end of the whole story.
Absolutely.
We need to check their blood pressure, we need to check their urine protein, their simple blood test of urea creatine and their kidney size, how their kidney size are growing over times up to 8 years of age. That need to be checked periodically. Otherwise, any harm in the early phase, if we can detect early, we might manage. If we detect late, we probably can't manage that much. So obviously, parents need to be little bit of not anxious, but there will be little bit of vigilant about these factors. Whenever there is some doubt, they can always contact in our clinic, in this pediatric nephro clinic, 24/7. We're doing currently weekly once, but the helplines are for open for all time. And any of the problem, we can jointly try to make their kidney life survival better, right?
Absolutely.
So thank you, Dr. Poonam, for being with us for the last 18 minutes. And this is not the end of the whole story, because if you, our audience who are listening this, if they have some kids with this type of problem or then in their neighborhoods, they can always help them by guiding them through a proper way. And if you have any doubt regarding any of the topics or any other investigations, they can always put their comment in our comment box. We will try to reply them as early as possible. And if there are any other doubts, we can solve it. So thanks once more, and a
Thank you,
happy
everybody.
kidney life for all our little kids with a prolonged, better kidney life.